In this video, we will show you how to store, thaw, and administer the COVID-19 vaccine Janssen. First, a few basic facts about the vaccine. The COVID-19 vaccine Janssen comes as a frozen, preservative-free multi-dose suspension. Each vial contains 5 doses of vaccine after thawing. And once thawed, the vaccine is ready to use. The recommended schedule for this vaccine is 1 dose, and the route of administration is an intramuscular injection in the upper arm. It is currently recommended to be administered to people who are 18 years of age and older. In clinical trials, a single dose of this vaccine was shown to be 66.9% effective against symptomatic SARS-CoV-2 infection. Against severe COVID-19, it was shown to be 76.7% effective after 14 days and 85.4% effective after 28 days. Its efficacy against hospitalizations was 93.1%. Next, let us review how the vaccine should be stored. Shelf life of frozen, unopened vials is 24 months, and they can be stored in a freezer at temperatures between -25 degrees Celsius and -15 degrees Celsius until the expiry date printed on the vial and outer carton. Thawed, unopened vaccine vials can be stored in a refrigerator at temperatures between 2 degrees Celsius and 8 degrees Celsius for up to 3 months once removed from the freezer, not exceeding the expiry date. The expiry date must be updated when the vaccine is removed from the freezer and before it is stored in the refrigerator. If a 3-month period finishes before the original expiry date printed on the outer carton, cross out the original expiry date on the outer carton and mark as not valid. Write down the new expiry date, which would be 3 months from the date you removed the vaccine from the freezer. The new expiry date should be written on both the outer carton and in the blank space on the vaccine vial. If a 3-month period finishes after the original expiry date printed on the outer carton, respect the original expiry date. Thawed open vials can be stored at 2 degrees Celsius to 8 degrees Celsius for up to 6 hours after the first dose has been withdrawn. Vials that have been thawed should never be returned to a freezer and refrozen. Do not store the vaccine in insulated passive containers with dry ice or ultra-low temperature phase change material or in a freezer below -40 degrees Celsius. Avoid exposure to direct sun or ultraviolet light. Store vaccine vials in the original outer carton to protect from light. While the vials are in storage or taken out for a vaccination session, minimize any exposure to light. Let us now talk about how to thaw and prepare the vaccine for administration. Before being administered to vaccine recipients, the vaccine, if stored frozen, needs to be thawed and brought to room temperature. This can be done in 2 ways. Vials may be thawed at room temperature up to 25 degrees Celsius. An individual vial takes about 1 hour to thaw, while a carton of 10 vials takes about 2 hours to thaw. Or the vials may be thawed in a refrigerator at 2 to 8 degrees Celsius. An individual vial takes about 2 hours to thaw in a refrigerator, and a carton of 10 vials takes about 12 hours to thaw. Once thawed, the vaccine is ready to use. Do not dilute. Once thawed, inspect the vial to make sure the liquid is colorless to slightly yellow and clear to very opalescent suspension. If any particulate matter and discoloration are present, do not use. Discard the vial. Swirl the vial gently in an upright position for 10 seconds. Do not shake the vial. On the vial label, write the date and time of first use. The first use is when you first puncture the vial and withdraw the first dose. Next, draw up a 0.5 milliliter dose into the AD syringe. Each vaccine vial contains 5 doses, so before withdrawing each subsequent dose, the vaccine vial should be gently swirled in an upright position for 10 seconds again. Administer the vaccine into the upper arm of the recipient using an intramuscular injection technique. After the first dose has been withdrawn, keep the vaccine vial at temperatures between 2 degrees Celsius and 8 degrees Celsius. Keep the opened vaccine vial in the foam pad of the vaccine carrier. There may be some vaccine left in the vial after you withdraw the 5th dose. Do not combine remaining vaccine from multiple vials. Discard the vial. Follow safe injection practices to avoid any needle stick injuries. Dispose of used syringes in a safety box immediately after vaccine administration. Discard opened vaccine vials after 6 hours or at the end of the immunization session, whichever comes first. To ensure the vaccine recipient's safety, ask them to sit in the waiting area for observation for 15 minutes after the injection. You should now know how to store, thaw, and administer the COVID-19 vaccine Janssen.